So good afternoon, everyone, and good morning for those who are joining us from WA. I'm Jessica Pratt, and I'm the Assistant Secretary of the Lung Cancer Screening and Cancer Infrastructure Branch at the Department of Health and Aged Care. First Assistant Secretary Lisa Schofield is hoping to join us today, but has been held up. So we'll kick off. And may I start by acknowledging the Ngunnawal people as the traditional custodians of the land on which I am today, and recognise other people or families with connection to the lands of the ACT and the region. I wish to acknowledge and respect their continuing culture and the contribution they make to the life of this city and region. And I also wanted to acknowledge the traditional custodians of the land on which you are all joining us from today. I'd also like to acknowledge and welcome other Aboriginal and Torres Strait Islander people who may be attending today's webinar. So first, thank you all for your time today. This webinar is being co-hosted by the Department of Health and Aged Care and our implementation partners, Cancer Australia and the National Aboriginal Community Controlled Health Organisation. Unfortunately, one of our co-hosts, Dr. Dawn Casey, is unable to be here today, but Dawn has kindly passed on some updates that she would like us to provide today. But I would like to welcome Claire Howlett, the Deputy CEO from Cancer Australia, who is joining me today. So please note that today's session is recorded and we're able to share and provide copies to anyone who would like to pass it on to their members or anyone who's missed today's session. You'll see on hopefully the right-hand side of your screen a panel called Slido. That's where you can ask questions throughout the webinar. You also might see other people's questions that you're quite interested in, so you can do a thumbs up and vote for those questions, and we'll answer as many as we can at the end of the session. So the purpose of today's webinar is to give you an overview of the implementation of the National Lung Cancer Screening Program. As you know, in the May budget this year, the government committed $263.8 million to establish the program and to have it up and running by July 2025. While we are in the very early stages of implementation, we wanted to give you an update and start our engagement with stakeholders early. So I'll start with an update on implementation, and then we'll hear from Claire about Cancer Australia's work, and then we'll chat a bit about consultation and opportunities for you to be involved throughout the process, and we'll take questions at the end. So just to touch on briefly, although I'm sure you're all quite familiar, the kind of journey and the overview, but as clinicians, experts, advocates, and those with lived experience, you know just how important it is that we screen for lung cancer, and catching it early is fundamental for better health outcomes, especially for those who are disproportionately impacted by lung cancer. Many of you have been working in this space for years. You know the journey to formalising the program, but a few key milestones to mention include August 2019, when the then Health Minister asked Cancer Australia to conduct an inquiry into the prospects, the process and the delivery of an Australian lung cancer screening program, to then Cancer Australia's feasibility study, which was finalised earlier this year, and also the endorsement of the Medical Services Advisory Committee, who supported the introduction of the program, including the creation of new MBS items for low-dose computed tomography scans to support the early detection of lung cancer in asymptomatic individuals. So this journey, of course, is well known to many of you, but it's really important to recognise the work of so many people and organisations in getting here. So thank you and congratulations. But now we're starting the next phase, designing and implementing the program, which will be no small feat. So thank you all for your help in advance. So as I said before, $263.8 million have been announced, along with a broader set of measures for tackling smoking and vaping and a First Nations cancer package. The Lung Cancer Screening Program is the first national new screening program in 20 years. So it's aimed at earlier detection of lung cancer when treatment is more likely to be effective. And as I mentioned, it will be implemented over a 2-year period from July 2025. So we, in our planning, have identified 7 work streams to implement the program, as depicted in the diagram that you can all hopefully see on your screen. The arrow moving across the bottom of the page is to signify that partnership is integral to all other streams of work in implementing this National Lung Cancer Screening Program. A process of co-design with First Nations people right from the start and throughout the journey will ensure that the program is culturally safe and equitable access is achieved across all work streams with a high uptake by First Nations people. So I'll leave Claire to talk about the clinical work stream that Cancer Australia has responsibility for, but I'll quickly walk you through the other work streams that are led by the Department of Health and Aged Care. So first, partnership. I'll talk further about the role that NACCHO will play in the co-design of the program shortly. However, a key element of the implementation will be around the partnership that we form to deliver safe and equitable access and services to First Nations people, people from culturally and linguistically diverse backgrounds, people with disability, and for people who live in rural and remote locations. Then we move on to the access workstream. So as part of the design and implementation of the program, we're considering available delivery models for mobile screening services and also broader supports to improve access for communities where CT services do not exist. Then we've got the MBS workstream. So we here at the department will be implementing 2 program-specific NBS items for low-dose CT scans, one for the initial scan and another one for any follow-up scans. The NBS items will be implemented as recommended by MSAC. The rebate will be in line with the existing NBS item for low-dose CT scans, and to reduce out-of-pocket costs for patients, bulk billing will be mandatory for these items. Then we move on to the National Cancer Screening Register. The NCSR, as many of you are familiar, is a register of information about cancer screening associated with certain types of cancer, and it's currently used for cervical and bowel screening. It assists participants with their healthcare and healthcare providers with the screening pathway. So we will be expanding the NCSR to include lung cancer screening to allow for data capture and linkage, participant workflow, follow-up correspondence, and to enable program assurance and evaluation processes. And to be able to do this, we move to the next work stream, which is legislation. And so to actually build the Cancer Screening Register in the NCSR, we need to amend the National Cancer Screening Act 2016 to include lung cancer as a designated cancer. We will also be developing a legislative instrument to enable reporting of lung cancer screening to the NCSR. And then finally, communications. So a communication strategy and package will be developed to support the rollout of the program. This will include a national communications campaign to reduce stigma and encourage participation and uptake, particularly for priority populations. As I mentioned earlier, the program was announced with a broader set of measures on tackling smoking and vaping. So smoking cessation will be integrated and embedded throughout the program. So also underpinning all of these work streams is not only stakeholder consultation and governance and engagement, but program governance. So we can ensure that best practice and continual improvements to the program are made into the future. And as recommended by MSAC, the program will be reviewed 2 years from the commencement to ensure that clinical effectiveness, safety, cost effectiveness are all realised. So we've been really encouraged with many stakeholders already reaching out to us. And so I would like to quickly touch on some initial areas under these work streams where we've had inquiries from stakeholders already, and hopefully you'll find them helpful. So first is about program eligibility and criteria. So we know that there are differing views on a number of key criteria, such as the age range, rebates, and the risk assessment tools. We are implementing the program in line with MSAC's recommendations, but our main priority really is to get the program up and running, and to do so in a way that makes it as simple and as open as possible for people who have smoked or smoke. As Minister Butler announced, the $263.8 million also includes funding for research, through which we will continue to assess and mature the program as we do with all other programs. We've also received a number of questions about workforce. So we know that some stakeholders are concerned about the workforce impact, from the impact on GPs as the entry point to the health system capacity to treat those who are identified through the program. Workforce modelling was completed as part of the feasibility assessment. The findings were that the increases in lung cancer cases are likely to be manageable, and over time there will be a reduction in people presenting with later stage disease, which may then reduce the workforce and health system impacts. But as you know, the Minister also announced in the 2023-24 budget a scope of practice review, which will support workforces to work at the top of their scope and assist the lung cancer screening pathway. For example, nurse practitioners and Aboriginal and Torres Strait Islander health practitioners will hopefully be able to refer patients into the program and radiology for low-dose CT scans. However, we will continue to consult with states and territories and stakeholders to ensure preparedness for health system impacts and the national program. And there'll also be a range of supports for clinicians, which Claire will talk about shortly, from clinical guidelines to workforce training and support. Sorry, I'm just gonna feel like I've been talking forever. So as you can see from those work streams, we have a lot to do by July 2025. The diagram now on your screen shows how interconnected and interdependent those work streams are. While there are some pieces of work that will become more crucial later down the track, we need to start each work stream now to support the others. So I wanted to assure you that while you may not immediately see what's happening due to government processes or things like commercial and confidence arrangements, we are starting. As you can see, there are some pretty obvious and fixed timeframes. For example, passing the legislation to enable the build of the NCSR, and that's underpinned and predicated on the clinical guidance from those guidelines. So we will be engaging and consulting with all of you throughout the design and implementation of the program, not just at the end. And we also just wanted to touch on some of the key bodies that will be governing the implementation of the program. So there are going to be two key governance advisory bodies. The first is a program advisory group. It's an intergovernmental body with representation from all states and territories, as well as NACCHO and Cancer Australia. It will provide specific oversight of the operational implementation of the program on a state and territory level. Then the second committee is an expert advisory group. So this will be a multidisciplinary group of clinicians who will provide advice to inform implementation, quality and safety of the program. And also this group will have representation from relevant sectors and will be supported by various working groups as needed. Both groups will include consumers with lived experience. So while we are working to ensure these groups complement the many existing structures facilitated by Cancer Australia and NACCHO, we're working to ensure that they all link together, because we know that there's so many valuable people involved in this process. So on to the next slide. In Dawn's absence, today she's asked that I touch on some of the key messages around the co-design of the program. So many of you know that cancer has been a leading cause of death for Aboriginal and Torres Strait Islander people in recent years. We know that lung cancer disproportionately affects First Nations people, and therefore it's integral that the screening program be designed accordingly. The Department and Cancer Australia will undertake the process of co-design in partnership with NACCHO to ensure that the program is culturally safe and equitable, noting that if we get it right for First Nations people, we will get it right for everybody. The program will be co-designed with the First Nations community-controlled health sector to maximise prevention and early detection of lung cancer and achieve the equity in cancer outcomes for this priority group. As many of you may know, NACCHO is the national peak body for Aboriginal and Torres Strait Islander health in Australia, representing 145 Aboriginal controlled health organisations. This map on the screen shows you where NACCHO's members are located across the country. ACCHOs provide 3.1 million episodes of care for almost 500,000 people each year. NACCHO's main role is to provide advice and guidance to the government on policy and budget matters and advocate for sector-informed and sector-delivered solutions in line with the National Agreement on Closing the Gap. NACCHO has expanded significantly in recent years and this now includes the establishment of its own cancer team. Up until recently, NACCHO has provided advice on cancer policy through submissions and committee memberships, but had not had a team to drive reform. So this additional expertise will enable a targeted program of co-design through the ACCHOs to determine the most appropriate implementation strategies and supports to ensure equity across the program. As I mentioned earlier, NACCHO will also have their representatives actively participating across the program's governance structure to ensure that First Nations voice is applied to all the work streams mentioned. They will assist in the co-design of clinical materials and training to ensure the appropriateness for the First Nations workforce. ACCHOs will be provided an opportunity to customise participant information to ensure cultural safety and appropriateness on country. So now I'll hand to Claire to provide us an update on Cancer Australia's work.
Thanks, Jess. Give you a break.
Thank you.
Hello, everyone. Cancer Australia will be leading the clinical screening, and from the slide you can see there are 5 sub-work streams involved there. Each of these work streams will be building on the work that has already been done both through the lung screening inquiry and also the feasibility work that we completed earlier this year, and the full report of that feasibility work is available on Cancer Australia's website. There's a lot of text on this slide, which I'm sure you can read for yourself, but I'll take you through each work stream just at a high level to explain what's involved in each of them. The first is the clinical guidelines and other protocols, which will help establish the program parameters and the requirements to ensure a nationally consistent and evidence-based program. This work stream will deliver the clinical materials and resources to support the operationalisation of the program, which will include the screening and assessment pathway, recommendations and protocols across those pathways, nodule management guidelines and standardised structured reporting for radiology and pathology, materials to support referrals, consent and shared decision making. We'll also develop an eligibility calculator for determining participation. This stream of work is one that has many interdependencies and really needs to inform the design of the register, and will also inform the communications activities. So this is the piece of work that we will be giving first priority to, and then moving into the other streams. The second piece, information materials. These will support all audiences involved in the program to include knowledge and awareness raising. They'll include information across the program, including the participant journey, and will target a range of audiences. So there'll be materials for primary care practitioners, including GPs, nurse practitioners, Aboriginal and Torres Strait Islander health workers, radiologists and radiographers, other specialists, program participants, as well as those consumers who may be determined ineligible, and also for quitline counsellors to ensure that we've got that good connectivity between the program and assisting smoking cessation. The third work stream will be workforce training and education materials. This will be developing and providing the training modules to help each of the workforce groups to understand and undertake their role in the program in line with the pathway and the guidelines and protocols. There will be education on the program for primary care workers, and as well as education and training for radiologists, particularly around the nodule management guidelines and reporting. The next stream is monitoring quality, safety and evaluation. This is essential in good program management and design to ensure we have a safe and effective program and to inform adaptation of the program over time. Key performance indicators will provide the minimum data set for the program, and quality assurance and data governance frameworks will detail how these KPIs are going to be measured, what data needs to be collected, how it's to be reported to the register. Data linkage will enable data from the register to be linked with data from existing registries to give a complete data set, which will enable program monitoring and evaluation to understand the effectiveness of the program and impact over time. Finally, as Jess mentioned, there is specific funding for research grants for the program. This will enable us to have an agile program that's able to integrate and adapt to new evidence and technologies over time. Funding will enable the program-specific research activities that will contribute to this agility and ensure that we can continue to evolve the program to keep up with emerging technology and knowledge in the field. Thanks, Jess. Back to you.
Great, thank you, Claire. So we understand that many of you are keen to be involved in the development of the National Lung Cancer Screening Program. Harnessing your expertise and views is critical to the success of the program from a clinical and operational perspective. The precise dates and details of each consultation are yet to be formalised, and they'll continue to evolve as we work through design and implementation. However, please rest assured that there will be many opportunities to feed into the streams of work. We've talked you through key design and implementation work streams, but just to give you an indication of a couple of the key pieces of work and their timings, co-design work has already commenced and will be embedded every step along the way. There will be engagement opportunities late in 2023 and early in 2024. Including to support priority populations such as culturally and linguistically diverse people, people from rural and remote locations, and people with disability. So then also development of the clinical guidelines work that will be well underway by the end of this year, with consultations in the first half of 2024. Legislation changes are in train, with the legislation to be introduced into Parliament in the first half of 2024. Consultation on the scope of patient data and to be collected through the NCSR will commence in early 2024 to inform the subordinate legislation. And workforce training materials, as well as education and awareness pieces, will commence work in mid-2024 and will complement the build off other work like the clinical guidelines. Consultations on the communication strategies will commence mid-2024. So you are also welcome to contact us with the details of stakeholders that it's important for us to engage with during the design and implementation process, and we will continue to do implementation updates along the way. For example, we'll have another webinar before the end of this year to continue to give you implementation updates.